So welcome to the Markham Stouffville Hospital open house presentation. My name is Dr. Amanda West, and I'm one of the co-site directors at the Markham Stouffville site. I am currently sharing the role with another physician who's in transition. So where is Markham? We are a suburb of Toronto, approximately 40 minutes, depending on traffic, northeast of the downtown core. We are a very multicultural community with a number of new immigrants and first-generation Canadians, most of them from the South Asian community or the Asian community. A lot of our patients speak a variety of languages outside of English, including Cantonese, Mandarin, Punjabi, Tamil, and a variety of other languages. And we serve not only the Markham community, but also Stouffville, Uxbridge, and a number of smaller communities in the York region and North Durham regions. So our program, we are expecting to accept 8 Canadian medical graduates for the 2019-2020 years and 1 international medicine graduate. We are a horizontal program, so you do have 3 half-day backs or HDBs, which you'll see later in the schedules, per week, no matter the rotation that you're on, and we do not have a block of family medicine. You're doing your family medicine throughout the 2 years. We are considered a preceptor-based model. We have a family medicine teaching unit, and there are 13 family doctors who work out of the unit, all who do teaching with our residents. Each resident will be given a practice of approximately 150 to 200 patients, which all of whom will consider that resident to be their primary family doctor, and you will provide all care for those patients during your time with us. So this is our rotations for year 1 and year 2. We have 2 electives in our first year and 4 electives in our second year. We have a number of selectives in the second year, which means that you're able to choose any area of that specialty for those rotations. An example of what one of our core rotations might look like, this is our PGY1 pediatrics. So you can see that you have 3 areas where you have your half-day backs. That's done in the family medicine clinic. You have a Wednesday morning didactic sessions or more hands-on sessions called the academic half-day, which is common to all the sites, and then a variety of different clinics in pediatrics to try and give you a full breadth of community pediatrics in a number of areas that would be of interest to family medicine. So highlights of the program. So when speaking to our residents, they feel that the highlights to our program is it's a comprehensive program. It's a community-based program. So at Markham Stouffville Hospital, there is only family medicine based in the hospital. There are very few other residents. You are not on a hierarchical team with junior residents, senior residents, off-service, on-service. You are the only resident often on the team. And so there's really one-to-one teaching, and the specialists are really interested in learning what you want to learn and what's important to you to becoming a family doctor. So it's really focused on family medicine and what we need to learn as family doctors, and not how to make you into their specialty. Global health. So many of our residents are coming to us for our global health program. So we are the only site at the University of Toronto with a dedicated health equity global health rotation, which can be done either locally or internationally. We also have a global health director, Dr. Melanie Henry, and she helps to organize monthly lunch rounds for the residents and staff, as well as there is a monthly global health teaching, which really focuses on the social determinants of health as part of our academic half day. In the picture, you can see one of our past residents, Dr. Choi, who did a rotation in the Philippines under the supervision of Dr. Bertucci. These particular pictures, we're looking at the procedures day, which was run by our emergency medicine colleagues who brought in all the supplies to teach suturing and biopsies. They've had castings. We do gynecological procedures teaching as part of our academic half days, talking about IUD insertions and endometrial biopsies. We have a gynecological procedures clinic and a minor procedures clinic as part of our family medicine teaching unit, and all the residents residents rotate through that, and it's all taught by family medicine. All our emerge docs are also family medicine as well, so it's really got a very strong family medicine focus to our procedures teaching. As well, we have a beautiful resident space in our teaching unit. So this is one side of it. So there are approximately 10 computers that are only for the residents, for finishing notes, checking hospital records, really just an area also for the residents to come together and share in their common experiences. And this is outside of the area of the unit that's dedicated to seeing patients, that is meant for just the residents. So that concludes my presentation. If you have any questions, we're always more than happy to hear from you. This is so you can see my contact information, as well as for our 2 chief residents, Sahana and Sia, and our program director, Beverly Nutt. We're more than happy to have you come visit the site as well. Feel free just to send us an email. Thank you.